After the first operation, the patients are taken back to the recovery room where they're monitored closely, usually for an hour or so. I then like a CT scan to be performed, and that's really to check that not only the electrodes are in the right position, but also to make sure that there's not a significant amount of bleeding or swelling or any other problems. And that's fairly uncommon that would occur, but you're better off to know about that early rather than later. Patients then go back to the ward where they'll recover over the next few hours, and usually by that stage they're able to have a drink and something to eat and talk to their relatives if their relatives are there at that point in time. I usually like patients to get up and walk around fairly early after the surgery to reduce the chance of blood clots in their legs and their lungs, and patients can go home a couple of days later if they're feeling up to it. After returning home after this type of operation, it's fairly common to experience occasional headaches, to experience problems with concentration, some lethargy, maybe some irritability. And that's all very normal after undergoing any type of brain surgery, and those symptoms usually settle over a period of weeks or months. After the second operation, the patients go to the recovery room where they're monitored for a short period of time, and then they go back up to the ward. They're usually fairly sore around their neck, because that's where we put the extension leads, and there may be a little bit of discomfort around the battery under their collarbone. That discomfort usually settles over the next few days, and they can generally go home 1 or 2 days after that operation.